All right, so that was our treatment approach. Well, stages 1 through 3, then stage 4 and relapse. Now let's talk about the actual treatments that we're using. We're going to start off with hormonal therapy. In order to understand the role of tamoxifen versus the role of aromatase inhibitors, we have to familiarize ourselves with the sources of estrogen in the female body. So a woman has two sources of estrogen. A premenopausal woman has primarily the ovarian pathway, the pituitary gland producing gonadotropins that stimulate the ovaries to produce estrogens. That's the pathway that we always think about when we think about estrogen production. That accounts for about 90% of estrogen in a premenopausal woman. But there's a secondary pathway, and this pathway is present in both premenopausal and postmenopausal women. Pituitary gland produces ACTH, which stimulates the adrenal glands to produce androgens. Those androgens can then be converted by the aromatase enzyme into estrogens. And this is where that distinction between premenopausal and postmenopausal is so important. A postmenopausal woman only has the right side of the pathway. Postmenopausal women only have the adrenal pathway for estrogen production. But a premenopausal woman, on the other hand, has the ovarian pathway and the adrenal pathway. So if we were to use an aromatase inhibitor in a premenopausal woman, it would only shut off the minor pathway. The primary ovarian pathway would still be present, and the drug would be ineffective. In a postmenopausal woman, all they have is the minor pathway, and so aromatase inhibitors are highly effective. Select estrogen receptor modulators just block at the receptor. It doesn't matter where the estrogen is coming from, it blocks the estrogen at the level of the receptor in the breast. So premenopausal or postmenopausal, it can have effect. And then, as we mentioned, the aromatase inhibitors inhibit the enzyme that's converting androgens to estrogens. Our hormonal therapy is only used if our estrogen or progesterone receptors are positive. Mentioned again that tamoxifen is used in premenopausal women, aromatase inhibitors are used in postmenopausal women. In stages 1 through 3, the recommended duration is 5 years. There's some evidence to support longer duration of use up to 10 years. The overall recommendation currently is 5 years. And in stages 1, 2, and 3, we actually give it after chemotherapy is finished. So it's kind of a long-term maintenance therapy after chemo is done. In patients with stage 4 or relapse disease, our duration is unlimited. And additionally, in patients with stage 4 and relapse, a lot of times we'll give it at the same time as chemotherapy.